Thanks to Ed for not only taking my opening joke, but also my sport coat. So I'm going to add an impromptu question for the touchpads here, and it's just quickly, it's not going to be on the computer screen, it's basically this. What's the best thing about going last? A, you get to say whatever the hell you want because there's no one left to rebut it. Or B, as we noticed this morning, you can get to say whatever the hell you want because everybody's hungry and they're not going to listen anyways. So probably a bit of a combination on both. So you guys know that I'm Robin Hunter. I am the, I guess, the one person in the room who actually currently still does work at Roche. So other than being the center of excellence for developing future leaders in the pharmaceutical industry, what does everybody know about the company called Roche? Some of you may think about Genentech, which we just finished our acquisition of them. I did that personally, about $45 billion out of my pocket. So I'll also be passing around a hat. At the end of last year, some of you may think about the products, the biotechnology products that we sell here in Canada from Roche. Some of you may specifically think about oncology. We have pretty much the top 3 oncology brands globally. Those brands would be Rituxan, Herceptin, and Avastin. All in Canada, they do about $350 to $400 million in oncology. Some of you may have been paying attention to the media this past year on Avastin. Maybe specifically in Ontario, an ombudsman investigation was actually triggered against the government, which did lead to successful listing of Avastin in Ontario and getting access to patients who desperately needed that product. So with all that in mind, I'm not going to talk about any of those things. And I'm going to draw your attention to part of the business that maybe a lot of people don't know about Roche. We do compete in a couple of smaller specialty markets. And I want to talk to you a little bit about that. And I think the speakers over the course of the morning have done an excellent job painting the picture of the environment that we have to play in. Ed painted the picture quite nicely about the differences in having to sell and market and plan in the specialty environment. I want to put the lens squarely on all of us in this room and talk about some of the things that we need to do better if we want to do one thing that we're all need to do, which is enhance our own profitability. And the title of the talk is Stop Incenting Your Customers to Split Your Business. And I'm going to talk about this in 2 case studies. The first one is just to whet your appetite a little bit, a small specialty market. And then the second one is to, we're going to dig into a little bit differently. And again, they're both specialty markets where there's significant competition out there. So the first one is we have a marketplace where we did about $12.5 million a year in sales. The overall market was worth roughly $30 million. We had about headcount of 6, again in line with what Ed had just told you in his HIV market. A&P spent about $1 million a year in this marketplace. There are 3 companies vying in this market. The market had not grown in 5 years. There's about 8,400 total cases of this disease. However, only about 1,000 to 1,200 of those are treated. In many cases, again, that is reimbursement driven. You can have a disease where you see 1,000 to 10,000 patients, but your reimbursement criteria will limit use quite severely. About each of the clinics across Canada, and there was about 15 to 20 of them, each saw about 17 new patients per year. Once somebody started on any of the brands, switching between brands rarely, if ever, occurred. Which I just said. And the share split between the 3 companies that were playing in this market was 40%, 40%, and 20%. So what each of the companies had, well, we all had a sales force. We all marketed and sold our products. We all had messages that if you were the physician or the nurse listening to these messages, you would feel quite compelled to think, oh, their product must be better. However, everybody's message said the same thing. Our product is more safe, more efficacious, more convenient for your patient. We all had a registry. We all had a compassionate use program. We all had a significant amount of education. We did all sponsor physicians and nurses to conferences within the RX&D Code of Conduct, of course, although this was 5 years ago, so that could be debatable. You'll notice that I get a whole lot more brave the further distance Ronnie is from the country at this time. We all had patient assistance programs. We all funded, to some extent, or educated or supported nurses to go out there and teach patients how to inject themselves with this biologic drug. So if you asked any of the customers, it was quite a novel thing to do, was to ask your customers. They said to us, there's absolutely no difference between any of your brands. I can use any one of the three and I will get the same outcomes for my patient. Therefore, it is only fair if we give each of you a little bit of the business. So if you look at that situation and the picture I painted, here's the question I will... Sorry, one last thing. This is how people made their decision in this marketplace. So the physician would decide that, yeah, I'm going to treat this patient with these types of medications. And at that point, the physician would either have a loyalty to one of the brands or to one of the companies and would use that product 80 to 100% of the time. There were a very small percentage of customers or clinics out there who would turn that decision over to the family and say, here are all the products, you will get the same outcome from all of them. Each one of them has a slightly different injection device or patient support program. You make the decision. We will be happy to support you with whatever that is. And the last one is those market splitters, and I'm sure none of us have heard of them, but these are the ones. And in this case, there were places, one in BC in particular, actually had an Excel spreadsheet. This is how I learned to use Excel from this one customer, who split the business, one-third, 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 and tracked it down. And her forecast was better than ours, which is another problem. But it was plus or minus 0.1%. It was she was unbelievable. But she split the business, and for her, in her mind, she was being fair to all three companies. So given all of this, what would each of you do? So let's just say that, there we go, the first bullet, focus on the splitters. I mean, there's other options you could do. Focus on the families, focus on converting the competitor loyalists. So those are your three segments of decision makers. Get out of the market or increase your investment. And I guess the last one you could say increase your investment either selectively or across the board. And you saved the good music for last. Focus on the splitters, which is interesting. So I'll tell you what we did. We got out. We got out, and here's what happened. Our sales went up by $1 million the next year. On top of $12 million, that's pretty good. So we increased our sales by $1 million, saved 6 headcount, which we redistributed in the rest of the organization. Kept a little bit of A&P to make sure that we had patient kits and support materials and those kind of things. And obviously our profitability went up significantly. 5 years later, our sales are still around $12.5 million. And of course, our headcount in A&P is still down around a minuscule level. So we at Roche have the luxury maybe of making the decision that some companies cannot make, but at this point is if you can't differentiate product in the mind of your customers, you can do a few things. You can keep going out and telling them that they're wrong, that your product is better, or you can finally listen to them and say, okay, well, trying to convince them that my product is better isn't going to work. Is there another way of doing this? Before I get out of this slide, I'll say that